I will give you a short overview about the benefits of bariatric surgery on fatty liver disease. The obesity epidemic has led to a dramatic rise in the obesity-related liver disease, and we call it now MESLD, metabolic associated steatotic liver disease, previously known as NAFLD. Here you see that MESLD affects 1/4 of the global population. The obesity epidemic has also shifted the indications for liver transplantation. On the right, you see that the indications for liver transplantation for cirrhosis due to an underlying steatohepatitis rise rapidly, not only in the US, but also in Europe. And the number of development of hepatocellular carcinoma on the background of steatohepatitis has increased 11-fold during the last 15 years. Weight loss is and remains the cornerstone of the treatment for MESLD. When you have a change in lifestyle and you lose more than 10% of your weight, there is a remission of steatohepatitis possible in 90% and also resolution of fibrosis in 45%. So we know that the amount of weight loss is correlated with the improvement of steatohepatitis. But we all know lifestyle modification works, but it's very hard to achieve. We have no golden pill at this moment to cure steatohepatitis. Promising drugs such as semaglutide and lanifibranor are in clinical trials. And this brings me, of course, to the top of the pyramid, bariatric surgery. Bariatric surgery can be an effective treatment for sustained weight loss in obese patients with steatohepatitis. The impact of bariatric surgery on the long term for steatohepatitis has been nicely shown by the group of Lille. They performed a prospective trial where they performed biopsies at the moment of surgery, predominantly bypass procedures, 1 year and 5 years later. 5 years after bariatric surgery, there were 85% of the patients who have a remission of a resolution of their steatohepatitis. The remaining 15% of the patients who didn't respond had a lower weight loss and also a higher insulin resistance profile. There is also a benefit in the evolution of fibrosis. Fibrosis regressed gradually, and 70% could show an improvement compared to their level of fibrosis at baseline. And even more important here, on the left, you see that there is also in the group with a high advanced fibrosis, a grade 3 fibrosis, in this group also 45% of the patients showed a resolution of their grade of fibrosis. There is not only an impact on the liver after bariatric surgery, but also an impact on the MESLD-related malignancies. And there is also an impact not only on the major liver outcomes, but also on the major adverse cardiac events, even 10 years after bariatric surgery when you compare both groups. All these positive effects in previous prospective and retrospective trials were confirmed recently in the BRAVES trial, published this year in The Lancet. This is the first trial comparing directly lifestyle modifications versus 2 other surgical techniques, the bypass procedure and the sleeve. And here you can see a part of the results. You see in the 2 surgical groups, there is a statistically better effect of resolution of NASH without worsening of fibrosis, and there is also an improvement of at least 1 stage of liver fibrosis without worsening of steatohepatitis. How does it work? It is not only weight loss that leads to a benefit on the liver, but also changing in gut hormones, bile acid levels, or a decrease in adipose tissue inflammation. All these factors has an effect on insulin resistance, and we know that insulin resistance is the key player in the pathophysiology of steatohepatitis. So we could ask ourselves, which patients could benefit from bariatric surgery. Of course, the patients with the steatohepatitis and fibrosis would otherwise meet the criteria, but probably also obese patients with fibrosis and steatohepatitis and have a less BMI, a BMI above 35. And the expected improvement is, of course, improvement in every stage of the liver disease. So, dear colleagues, to conclude, benefits of surgical bariatric procedures in MESLD patients leads to a high rates of resolution of steatohepatitis and fibrosis. There is long-term beneficial effects on the liver and other comorbidities, and hopefully we can prevent the development of cirrhosis and development of hepatocellular carcinoma, and of course, hopefully decrease the need for liver transplantation. What is the benefit for endoscopic treatments? We know already that they ameliorate the MESLD by improving steatosis and insulin resistance. Now we are waiting on long-term effects in the clinical trials that are currently running. But I think they could have a role in the critical gap between the less effect of lifestyle modification and the invasive bariatric surgical procedures.
The adverse events, if they occur, may be severe, and so this is a reason why these examinations should be performed by experts in lumen-opposing metal stent placement. And the lumen-opposing metal stents, unfortunately, are quite expensive. So there is some clinical data suggesting that the edge procedure with lumen-opposing metal stents performs better than endoscopy-assisted ERCP in terms of technical success. This is definitely the case. I would say mean procedural time and a median length of hospital stay, and it does not come with a cost of increased adverse events. So this is a study, 30 patients in each group, published in 2018. We at our university hospital, we have performed 48 gate procedures thus far. 42 of them were for pancreaticobiliary interventions, so were edge procedures or EUS procedures, diagnostic EUS procedures. And we had adverse events in 4 of these patients.
We have no golden pill at this moment to cure steatohepatitis. Promising drugs such as semaglutide and lanifibranor are in clinical trials, and this brings me, of course, to the top of the pyramid: bariatric surgery. Bariatric surgery can be an effective treatment for sustained weight loss in obese patients with steatohepatitis. The impact of bariatric surgery on the long term for steatohepatitis